All right, everybody, welcome to lesson 2 of module 1. In this lesson, we're going to go through the mental framework of a fast documenter. Here are the items we'll cover. This is a big and important lesson here. We want to cover defining concrete timeframes for a full note. So how long is it really taking us to do a note? We want to pin that down. The note is part of the patient. We want to internalize this belief and stop thinking that it is not, or that it can be done later. It is just itemizing it as part of the patient will help us get this done. Avoiding cognitive overload, clarifying your documentation goals, the importance of not repeating information, decreasing transition times, keyboard to mouse and patient to computer, and creating standardization to avoid mental blocks and writer's block when you're just sitting down in front of your computer and you forget what you were going to write about the patient. So using this improvement in mental framework, we're going to carry that into module 2 for immediate success. So defining concrete timeframes for a full note. Just to get this down and get the logistics down, your goal note time is about 3 minutes, maybe 3 to 4.5 minutes. You're looking at 1.5 minutes for an HPI, ROS, and physical exam, and this should be even less in some cases, and 1.5 minutes for an MDM and a disposition. Again, this is going to be an average among patients. However, some you will be able to get done in 30 to 45 seconds up front, and some will be quicker on the back end as well and will take longer. Your goal is to save time on the patients that don't need those long and hefty notes, so that you can contribute time towards the patients that do need longer notes, patients who may have had critical findings and critical events occur. So keep this in mind. My system is the following, and I would urge you to do something similar. When I see a patient, I'm placing orders if they're not already done, and then 1.5 minutes is spent doing the front end of the note. This is the HPI, the review of systems, and the physical exam. Those are getting done right with the orders. If the patient is not in the system yet by any chance, I will start writing the note immediately in a notepad, and as soon as the patient pops up on the chart, I will start placing orders. These are interlaced together. Start all notes at a patient encounter. So if you are by any chance leaving that to a later time, I'll go see some patients and I will come back. That may be appropriate if you have a limit, but after a while it'll get out of hand. You need to start all notes at patient encounter, and that's an HPI and a review of systems and a physical exam. Again, this should not be anything too time consuming, and that's the whole point of it. It's not time consuming, it'll offload your brain. And then you're finishing all notes at patient disposition. Again, the note is part of the patient, and it needs to be complete when the patient care is complete. So that includes MDM, meds, and discharge instructions. Just a little thing here. Personally, I will not go back into the note after I put in the HPI, the review of systems, and physical exam. I will not go back into the note until I know the full disposition. And that's because I want to decrease the amount of time I'm going back into and out of the note. That's all clicks. That's all time-consuming processes. So I go into the note once in the beginning, once in the end, and that note is complete. So your overall concept here is a note that may take you 3 minutes at work can actually take you over 10 minutes at home. And for the reason that now your recall is harder on the brain and takes more energy. You're more physically fatigued. So trading 3 minutes now will save 10 to 15 minutes later. And you can already imagine how that would add up if, say, you had 10 notes. You took 30 minutes to finish them on shift, during your shift, as opposed to now you have 10 minutes times 10 notes. That's over 100 minutes. Okay. Another critical thing is you must time yourself. Time your speed for a note now. Take your phone or any other device, if your watch has a stopwatch on it, and time your note as you write it, and see where you are during your shift on your note times. This should not take you any extra time. It's not that much. but you need physical feedback to improve. So use a stopwatch on your phone until your total note time is around 3 minutes. And this is going to be very critical. Please just make sure to be aware of this. Time yourself. I'm going to re-emphasize this later. The second thing, the note is part of the patient. Your note is part of seeing the patient. Would you look at your patient's EKG the next day because there are too many EKGs? Of course not. But oftentimes we are deciding to do the note the next day because there's too many patients. If we reframe our mindset and treat the note like part of the patient encounter, then we'll begin to emphasize to ourselves how important it is to get that note done. Again, this will additionally help with thought organization. The note will actually help you organize your thoughts during the patient encounter. It's kind of like a blueprint of what you're going to do and what you plan to do, and you're putting it on paper, and it's another step of reaffirming the history that you've heard and seeing it laid out in front of your eyes. So putting information into the note will also offload non-critical information from your mind. You do not need at some point to know that the patient ate a new meal yesterday. That may be helpful later when everything is negative, but it needs to be offloaded onto paper as opposed to being held in your short-term memory. And so be very aware of how overworked your short-term memory is during an ER shift. It's critical, and it may go unnoticed by you and may begin to build up during the end of shift. Again, in terms of thought organization, having this note will provide you a reference during disposition. This can decrease frustration, can decrease having to go back and ask the patient something that they may have said that you slightly forgot. And our key goal here is to shave seconds everywhere we can, because they all add up in the end. A big thing that will continue to be a theme is avoiding cognitive overload. You want to think clearer and give the patient better care. Doing notes in real time actually helps you move faster. And the reason it does so is because it offloads your cognitive space. So you feel lighter when your note is complete. You don't feel that burden. Your brain is not having to fight to keep the information in your short-term memory. We already discussed this on the last slide, but it's worth reiterating. This allows you to deliver better and more thought-out patient care. So please internalize this. These are the things that somebody who's a fast documenter will always be thinking. It's not about the burden of the note right now, it's about the burden of having to think of all these patient histories as my shift progresses, and the stress that my brain will feel as I continue to build up notes. So again, this decreases the stress of having more notes. Stress can be an inhibitor to peak performance sometimes. The next thing is to make sure to clarify your documentation goals. So going through this will be important for us because it'll help us get a clear idea on why we are writing this note. What is not the goal of an emergency medicine note? And of course, this is my opinion, but take value of it where you see fit. The goal of this note is not to demonstrate extreme intelligence and knowledge. And maybe we can leave that up to the internal medicine physicians who will put out an essay into their chart. And the goal is not to document every prior medical ailment and all prior doctor visits and all historical issues. If you were to do this with every note, it's going to be obvious that it's going to be very difficult to finish a notes on time and to not have free time when you're at home, because you're basically writing a medical chart for the patient. These are what I see being the goals of the emergency medicine document. You want to have a billable note that meets the RVU requirements for a level 5 chart. You can go through them here. I will refrain from going through all the numbers. You want a note that's legally defensible. And you want evidence that you saw the patient and performed standard of care based off the chief complaint that you were presented with and the medical condition of the patient. You want to give yourself and other colleagues an idea of the clinical situation. And you want to offload cognitive space after that to allow you to treat patients effectively. Part of your note shouldn't just be for that patient, it should be for the efficiency of your workflow. So efficiency of your workflow is an unrealized goal of documentation, and really internalizing that will help as we proceed forward. Another mental framework of fast documentation is don't repeat information. So don't retype information. If you've mentioned a patient who does not have chest pain in the review of systems macro, then why repeat the information in the HPI? So oftentimes we'll say, patient presents with chest pain, does, it's been radiating and is pleuritic. No shortness of breath. And then we'll say no cough, no abdominal pain, no nausea, no fevers. And we'll go back into the review of systems, which already has those listed out, and we will re-click those following things. Additionally, every piece of repeated information and redundancy is another chance for mistakes and time wasted from patient care. So now every time you are repeating chief complaints in 2 different sections, you're having to cross-check those 2 and change those 2 every time. We will go through examples later, but I'm just setting this up here as try your best not to repeat information. This goes right along with avoiding click boxes, and everybody will have their opinion on this, but I don't believe that click boxes offer much in the way of a complete note, especially those in the HPI. If they're in the review of systems or physical exam and they're macros, then I believe differently. But in the HPI, those click boxes do not seem to be very helpful, and they cause you increased work. So they're not detailed, they don't provide coherent information, and they force you to repeat the information later anyways. I believe the thought is that it helps with the billing, but once you get your billing modifiers into your HPI, they're in there, and the billers will check those. Another thing to continue to thematically think is typing all information as close as possible, in as close a space as possible. So what I mean by that is when you're doing your HPI, right underneath it, you could put your meds, your allergies. You don't going to a whole separate part of the note to do that will increase your note time. So sometimes in the HPI, you can actually include some social history and then reference it in the HPI as opposed to retyping it. And we'll go through a video example right now. All right, so here we are in a note, standard note, and we want to emphasize some of the things we discussed. So first, we do want to make sure that we are not using these click boxes, clicking constant, improving, generalized, moderate. You could actually be done with a whole note, which will be more clear and comprehensive by the time somebody's done clicking these. So what we're always saying is, please reference HBI below for modifiers. This is a pre-completed note that already has these in here. I would not even write these in if you do not have pre-completed notes, which we will discuss. The main focus here is everything in a note is so dispersed out. You have your family history here, you have some surgical history here, your medical history is a little bit above that, and some social history on the bottom. We want to collect that into one location. So we're going to go up here and we're going to include all that right after our HPI. So here's a little text box that we get when we decide to do a note. And we can start. So say we started with our HPI, we had some sort of HPI going, and we've completed that. Now the next thing is we do not want to go off this and start doing every little click box for our past medical history and our surgical history. We want to collect this all into one area right here. We're going to reference the HPI. We're going to reference the HPI again for meds, past medical history. If they denies, it should already be pre-filled, and we can get through this pretty quickly, and I'll show you how. So say that patient has come in with chest pain. They've been having it for about 5 days. And I want you to notice that here's my mouse. It is not, I'm not clicking to move. We are decreasing our transition times, right? The course of this has been constant. And how am I getting to this? I am pressing F3 to get to these underscores. And we are going to go through that as this module continues. As module 2 continues. Our onset was gradual. Our character is dull. We have no alleviating factors. We have no exacerbating factors. And here we have part of our story. Anything else we want to add in, if they had DVT symptoms, we have that already pre-completed and ready to go for us. In fact, we should have already put in our up here their past medical history, their diabetic status, maybe on insulin, and so we are not coming back to this again. Okay, made some mistakes here. Anyways, what I want to emphasize is we have our past medical history, everything's here. Maybe they denied everything, and it is complete in a matter of seconds. How to keep things as close as possible within a note without actually having to jump out of your current text box, go to a whole different past medical history section, go to a whole different allergy section, just combine it into one place, and that way you don't have to take your hands off the keyboard, you don't have to go click more boxes, and that's going to be critical in improving your note speed. So decreasing transition times is something we're also going to pay heavy attention to in this course. So these are things where you go from your keyboard to your mouse and from your patient to your computer. And the one I'm going to emphasize is keyboard to mouse transitions. And these are critical. We never think of this, but it heavily decreases your note efficiency. So fast documenters are aware that movements between mouse and keyboard take a significant amount of time and slow down your note. Strategies for this will be discussed in the next module. I just want you to keep it in mind. And again, this is our thematics module. We have not gotten into the practical efficiency steps yet. Something to also keep in your mind is minimizing patient to computer time. If you have the ability to document in the room, log in while in the room and quickly type in your 1.5 minute HPI ROS and physical exam. As your patient finishes a discussion, this could be before or after you examine them, and this can take about 45 seconds to a minute. It should not detract from your bedside time. If you have the ability to do this with a computer in the room, I highly advise it, especially if you don't have scribes and if you don't have anybody else who can be concurrently working while you're getting a patient history. The next thing we want to focus on is, that we will focus on this course, is creating standardization to avoid mental blocks and writer's block. The worst thing is to sit there for 45 seconds as you remember what the patient was saying, as you try to start your note. And that can sometimes happen because your mind is processing a few different things and you sort of blank out. It's important to be aware that brain efficiency can be lower as you're thinking about multiple patients. Writer's block loses you time and allows the opportunity for you to be distracted. And as we know, in the emergency department, we are constantly being distracted with EKGs, questions, and updates from our nursing staff and everybody else. Creating a standardized process, as we will focus on in this note writing course, will decrease the amount of thinking that you have to do per note. That'll help maintain the important aspects of the note, but it will also help us work through writer's block and work more efficiently and faster. All these strategies will be emphasized in the next module. So here's what we learned, and in terms of the mental framework of a fast documenter. We've learned that it's important to define concrete timeframes for a full note. We've learned that it's important to time yourself right as we do this. We've learned that the note is part of the patient. If we can internalize this and believe that the note is not something to be done later, it will critically help us in getting notes done quicker. We've realized the importance of avoiding cognitive overload, that it's important to offload that note so we can think clearer and give better patient care. Additionally, we are clarifying the goals of our documentation. Maybe we don't need to include every past doctor visit the patient has had that they are mentioning. Maybe we don't need to include that in the last 7 days they've seen a GI doctor, have an upcoming appointment for cardiology, and also will be visiting their podiatrist when they may be here for an elbow pain. All right. We are realizing that it's important to not repeat information, and we're going to focus on strategies to do that. We all are also realizing it's important to decrease our transition times, something we may not have paid attention to, which is keyboard to mouse times. And we're realizing the importance of avoiding mental blocks and writer's block. So, Module 2 will get us started on how to actually practically do all of these things.
So here are some action items for this module that we can focus on. Number one, time yourself. You need to diagnose your baseline function in order for you to improve. So make sure you have some scale of what is your current time and what your goal is. And this will help you move a lot faster. Number two, internalize the idea that your note is tied to your patient and is as important as the patient encounter. Just like we talked about, you are not usually looking at an EKG 2 days later or your patient's labs 2 days later just because you had too many to look at. Same thing with the patient note. It is important and it helps you thought organize. So internalize that idea. Number three, be committed to creating the building blocks that will decrease your note time and improve your efficiency and patient care. As we go through the next module, we are going to start learning a lot of tips and tricks to improve our note time, but it will be up to the individual person, which is yourself, to actually implement these ideas into your current flow. So I'll leave you with this. Here we go. It is time to start building.